Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, giving you a shot of wellness. I'm Yasmin, and I'm the Member Engagement and Communications Manager at GIG Gulf. Last episode, we spoke about breast cancer, symptoms, prevention, and treatment options. We're here today to talk about a different aspect of treatment, and that's how it affects your mental health. Joining me today is Dr. Melanie Schlatter, a clinical health psychologist in American Hospital, Dubai. She has more than 16 years of experience in Dubai working closely with oncologists to help patients during this trying time. She's also on the board of Brest Friends, where she runs support groups for cancer patients and survivors. Thank you so much, Dr. Melanie, for being here with us.
Thank you so much. It's lovely to be here.
So why don't you start off by telling us how does mental health get impacted during cancer, be it the diagnosis or the treatment?
It gets impacted in a pretty significant way, and maybe it's important if I share what I can to introduce the whole concept of being diagnosed with cancer, and that's that.
Please, yes.
People are going about, I think, their daily lives, and just they've got families and businesses and work and things to worry about, families, and maybe one day someone is concerned about a symptom. It could be a lump or a bump or something that just makes them think, I've got to go and see my doctor. So what we know then is already there's a level of stress and uncertainty. Something's not quite right with my body, and maybe they delay going to the doctor. Maybe they don't, but they turn up to the doctor and maybe there are tests that need to be run. And so there's a bit more stress and a bit more like, what's going on? A bit of uncertainty. And this kind of grows and grows. So maybe the doctor calls them back for further tests, or they get suddenly maybe diagnosed with something like cancer. And at that point, I can definitely say everybody knows the date that they were diagnosed with cancer. They can tell you who they were talking to, who they were with, exactly what the room was like. And generally after that time, it all goes kind of blank. So it's a huge shock to the system, emotionally and mentally. So as I said, you've just got people, just normal people, and then bang, suddenly the whole world has changed and they're thrown into generally a hospital system. There's terminology, there are different doctors, different specialties, people they have to see. And so their world isn't the same for quite a period of time, whether it's weeks or months. Maybe they're told about what they have, the type of cancer, how bad it is or how good it is. They're told about what treatments are involved. So it is so much information for them to process and to take on board. So emotionally, because we know obviously most people haven't been through this before, it's a big shock. It's like an imprint on the brain that like, wow, scratch on the record. And so psychologically there's stress and anxiety and maybe symptoms of depression, and it goes from there. So cancer's not just being diagnosed and there are the emotions. It keeps on going with the treatments, with the updates, with the test results, and the waiting for these test results, and then going through the treatments and then seeing how your test results are at the end of the treatment, and then when you finish treatment. So it kind of goes on and on and on. And maybe we can talk about today, how different individuals go through it. But I think that gives kind of perspective that it's like a grief, it's just, it's this, something happens and there's the before and there's the after. And I always say it's like stepping on hopping on a train, and it's just suddenly going 180. And these people can do nothing about it. So emotionally, it's very, very sad that it's so underestimated, the toll it takes on people. All these people bravely showing up to their doctors and the hospitals and the clinics with whatever symptoms have been troubling them, or some of them just thinking, okay, this is fine, I'll get back to my summer holiday kind of thing. And that's not the case. So it's pretty significant.
So how do different people sort of cope with this news? I mean, are there different coping mechanisms? Do people sort of maybe are in denial about it?
It really depends on the individual, and it depends on all sorts of things, how they view themselves, how they view, what's happening to them. That might be dependent on sort of the level of support they have, what other issues, stresses that are going on, if they've had a past history of anxiety or depression, or if they've got any kind of ongoing stress. So you can't really predict how someone will cope or what's going to happen. And so some people will present to you and say, oh, I'm completely fine. And then later you'll find out that their life's in complete turmoil. and they've just been bearing it or pushing it down and trying to put on this brave face, trying to fight, trying to get through. And other people immediately will, yeah, denial, this isn't happening to me, it must be wrong. They go for second opinions, third opinions, and of course other people will break down on the spot, of course. So none of these we would pathologise, or make a big issue of. It's like, as I said, we go back to that huge shock, that scratch in the record, and someone's brain is trying to digest all of this information and cope with everything else that's been going on in their life the whole time, their responsibilities, their values, everything that this means to them is assailing, what they've been told about what the diagnosis is, the treatment plan, things like that. So, worst case, if you're sort of told this has been found late, or it has spread, or it's going to involve very complex and lengthy treatment, which is going to be hugely expensive. You probably wouldn't be getting much sleep that night. So we understand every possible reaction that comes through the door.
So do you wait for the patients to sort of take that step into seeking help with their mental health, or is it like protocol where if anyone is diagnosed with cancer, then they are automatically sort of referred to a psychiatrist to help them out, or a psychologist?
Yeah, well, I'm at a hospital and we work as a team. So, and we're still always trying to work on it, that when you come to the hospital, if you have been diagnosed, that you see your oncologist, you see your breast care nurse, maybe a radiologist, whoever's involved, and you see the psychologist and you see a dietitian as well. So we try to be part of the team, which means we get in there as soon as possible, if only to introduce, ourselves, to the person.
Like a support team, kind of?
Yeah, and so they also know that we appreciate what they're going through, that emotionally it's got an impact too, that it's not all about, I go to hospital and I get my medical treatment and I leave. We appreciate this is really tough for you. You've never been through this before. The treatment's not going to be nice and you're probably not going to feel great. Obviously physically as well, they're not going to feel great. So mentally, letting them know, through written information, me coming in, how are you going? What's up today? When you continually do that, when I keep presenting, showing up, sometimes I joke that I just need the tea trolley to sort of go around and just check in on everybody, but it's really appreciated. It's very rarely the person who'll just say, I don't really want to talk and I'm okay. Most people are open to having some kind of a conversation. And even if they're telling you they're fine, no problem at all. But we know that even if at the beginning they're fine, maybe they won't be down the track, and we let them just know at any time, we'll be here for you. So we try to keep it casual, and then if we need to book in actual structured sessions and maybe involve the family, we can do that too.
So can we say that almost everyone who is diagnosed with cancer ends up having some sort of mental health challenge, that it's sort of, as it's part of the diagnosis, that they will one way or the other have an impact on their mental health? Or is it sometimes that some people are more stable maybe when receiving this diagnosis?
Some people, of course, with what they're going through, it doesn't need to be like a clinical diagnosis. I don't actually like to label people and pathologise them. And if I say to someone who has cancer, you're depressed or this is depression, what help is that? But we look at the symptoms, is there, you having difficulty sleeping? Do you have a loss of appetite? Have you got a loss of pleasure in your life? Are you struggling in your relationships? This kind of thing. But some people obviously, so we take that for granted that they will feel some level of stress or anxiety or depression. But other people, they do tend to cope better. And maybe that's just because of their past. Maybe they've even had therapy in the past. And they may have their ups and downs, but they're pretty good on the whole. When it comes to an actual clinical diagnosis, that's when we'd start looking out for maybe more specific symptoms if someone was really presenting as being like very helpless or hopeless, or even considering, giving up treatment. If they're very panicky, that sort of not sleeping, this kind of thing, or having physical symptoms like heart palpitations and really kind of avoiding almost their life because of everything they're going through. So again, it's kind of an individual basis. You take an individual with like sort of a clean slate and you look at sort of who they are in the whole context of their life and what they've been exposed to before and what this means to them too.
Would you say there is a correlation between people who seek help for their mental health and the outcome of treatment?
That's a good question. There is obviously favourable evidence towards people who seek help because they're kind of identifying I'm in need, and they're going to then access and have access to resources that could be helpful for them. So just sort of coping strategies and way to respond in terms of sort of emotionally and psychologically to what they're going through. But there is a subset of people who will sort of say, look, I don't really need help because you know what, I have my family, or I have religious help, or I have spiritual beliefs that are so strong and valuable to me that I don't need kind of like maybe support groups or counselling or therapy or anything like that. Like they're quite strong in their convictions, and they equally, research even that I've done has shown that they can equally do as well as someone who reaches out to get help. But on the whole, reaching out for help is considered just a little bit better, of course, than not.
Because I don't think this is something that someone can go through alone. I mean, you need some sort of the support system, either it's family, friends, or support groups, or anything. But I don't think anyone can sort of go through that. I mean, if someone is just even having like a minor surgery, like they're having their appendix removed or something, even that requires some sort of support. So if it's something like cancer and it's ongoing and it's a lengthy treatment and there's surgeries and there might be chemotherapy, and then there's definitely they requires more support.
And unfortunately, you'd be surprised at how many people hold a lot of shame and embarrassment and humiliation, and even if it's breast cancer. So it'll be like, this is my femininity. I'm 25 years old. Why on earth would I want to tell people around me that I have to go through this? So they will hide away. So they might maybe just talk to me, but they don't tend to talk to other people, wider circle of friends. Will I be marriage worthy? This kind of thing. So it sometimes depends on the age of the person that you're seeing and what their beliefs are too.
Yeah, I never thought of it like that. I mean, now you've said it, and then it's just like a light bulb went on my head that, wow, this is a whole other aspect, and I don't think we are aware that maybe someone can be thinking of it that way, that it's like shameful or embarrassing or something like that. I mean, that's sad that culture or society has sort of forced these beliefs into people. So now not only am I dealing with cancer treatment, I'm also have to worry that I shouldn't be telling people about it. So
and also because chemotherapy can throw, people into early menopause.
yeah.
So, a 35-year-old are having hot flushes and going through menopause, or their skin getting thin, or that, of course, things like their hair falling out. I mean, it's a disaster psychologically. So you can imagine the emotions that go along with that.
So what can we do? I mean, if someone has a friend or a family member that is going through that, how can we support them?
My first statement would be that it depends on the individual. Because, we all know certain people that we could kind of say anything to and they'd be open to it, and other people we have to be very, very careful with our words. So in general, trying to be a helping hand in some way, whether it's listening to them, whether you're giving functional support, you're maybe taking them to an appointment, you're cooking a meal for them, you're helping out with their kids, just coming over to have a chat, this kind of thing. Sometimes just the generalised support is really, really appreciated. And it's letting people know that you'll be there for them. And unfortunately, I think people find that friends can suddenly maybe drop off and things like that, which can be a big shock to them, because people don't always know what to do, which is why it's such a good question. Like, it's, even if it's scary and it's like, my gosh, my friend's got cancer, what do I say, what do I do, what's the right thing to say? Everyone's so worried about what to say. It's just at least just say, I'm here if you need me, I can do these few things. Maybe you just do something surreptitiously, you leave something on the doorstep, or you just organise an appointment for their kids and take them out or something like that. But it's trying to be a little bit proactive, but also respecting the space that they need, because really, as I say, and probably what you've understood now, is it's just so much to be going through, and you can't say that the person will be predictable either. I mean, there's massive mood swings that come with all these treatments, and sometimes even maybe to your best friends you might just be a bit ratty, and sometimes, so we teach people that it's okay if your friend or your loved one is not in a great mood, or they're not answering their messages to you, or they're just saying, I'm fine, I don't need help. I've known people that have just said, I only want positivity. I don't want you to mention the word. We don't talk about it. We don't. And you just have to send them maybe positive things and nice things and cute things. And that's what we want and that they want. So as a friend, that's what we do. So trying to sort of figure out who your friend or your loved one is and just kind of riding those waves with them. But overall, I think any kind of functional support, emotional support, and maybe even directing them very gently, like there are groups, or I found some information. I'll leave it here. You want to read it? You can, you don't have to. So we never sort of force anything. It's not that prescriptive.
So maybe we could say that we should just listen to them, basically what they need, and maybe ask in an indirect way or just in a gentle way, like, what do you need from me? I'm here for you. Just tell me what you need, or what would you like me to do?
Yeah, absolutely. Just keeping it simple. And as I said, I mean, so many times I've been told about people who their friends just disappear. And that it's so hard for me as a psychologist to help people to understand that and reconcile that, because people are going through so much. I've had people, their partners leave them, at the time of diagnosis or after a surgery, because this is not what I signed up for. We hear things like that because people find it that difficult. It's like it's too much for me. So yeah, we see a lot. So if you can be that supportive person, it can be easier than you think, just doing some little meaningful things and just being there through that time.
Does it take a toll on like your social life or your relationships with your loved ones, partners, siblings, parents? Because I think it's not just something that the patient is going through. I mean, their close circle is also kind of going through that with them. So is it something like, are there mechanisms like a group therapy for all of them together, or like couples therapy or something like that? Does that help?
If they're open to it, we'd do it. And I'm always open to seeing families, because I think information's king too. Like, understand, what your loved one is going through. Some days they're going to be like this, or what do we know? A couple of days after treatment, this will happen, that will happen. They're likely to feel this. We know anger and depression are linked, so teaching people about what they're going to go through is a really important reason to have families involved. But again, it goes back to that individual situation, because you might have a couple who are already in difficult financial times, and they've got stresses between them, or they've got children with learning disabilities, needs kind of thing. And it's a huge stress to have one parent kind of out of that picture. So suddenly, if it's the breast cancer, if it's mum, or in fact, men can get breast cancer, but maybe not able to work, or not able to be as helpful with the kids, not able to cook, can't stand the smell of food, can't be around, the kids are too loud. It leaves it all on the other spouse, and that burden shifts, and so there can be resentment and animosity and getting frustrated with each other, and you're not doing it the way I normally do it, and things like this. So a lot of difficulties can come out of it, but also people can get a lot stronger together too. They suddenly realise, wow, look what this cancer's shown us, I've got so much compassion for you now. Or they bond and they connect, it and actually makes them stronger, because they realise whatever they were worrying about before doesn't matter in comparison to
It's meaningless.
their lives. Yeah. So again, depends on sort of who you're seeing and what their situation is. I mean, we see a lot of people who they're getting younger and they're single. So they might be here from another country, they're alone, they're trying to get some income, sending it back home, have no financial resources, maybe a community, but not access to the best medical care and things. So again, very, very difficult and challenging.
What would you recommend for cancer patients, like if there's some kind of, not activities, but just coping mechanisms, something that they can do to sort of help them go through that? If there are any lifestyle changes or anything that they can do to just assist them or support them through the treatment?
Yeah. One of the main things I focus on is helping people to calm down. And, we're going to get thoughts and we're going to get feelings and we're going to get sensations, but it's how we respond to it. if I get thoughts about my illness and I suddenly look at it and I get buried in it, and you've kind of lost me. I'm buried in my world of worries and thoughts and fears. And so we tell people, we teach them how to respond differently, and that's very calmly, trying to get them in there, just the present moment. Like, we just need to get you through this hour, this afternoon, this evening. So a lot of calming, relaxation, breathing. It could be listening to nice things. They could even be watching funny things. Journaling, obviously exercise. A lot of people make changes to their diet. They can do that. It's like whatever they need to do to empower themselves. But whatever people do, as long as it's giving them like a sense of control and ownership of the process. Because of course, when you're told that you have something like this, it totally throws people, obviously, and it's totally helpless, out of control. But if I can say, oh, I've changed my diet and that feels good, this feels like the right diet for me. And you know what, no matter what, I'm going to walk 20 minutes a day. We'll just do some stretches. Like, they're starting to do things that's building up that sort of resilience and that psychological repertoire. But lots of emphasis on just that calming, like you just need to get through today. And we normally say that, any worries that you have, write them down and we'll see if we can do some problem solving. And anything that you've got no control over. So if you're lying there awake and thinking about the future and what's going to happen to the kids and my future, we just say again, that's when you do the calming and the relaxation to sort of teach your body that even with the stressful stuff, I can be calm. I see it, I'm aware of it, but kind of realizing there's nothing I can do. But the stuff you can do, yep, I'm going to change my diet, I'm going to exercise, write it down, do it, setting little goals, and of course joining, if you want to, if you're that kind of person, support groups, or reaching out to a support group and being matched to someone who's similar in maybe age or nationality or any other kind of parameters that make them feel, yeah, this is someone who might understand what I'm going through.
How do cancer patients usually tolerate or sort of accept the physical changes that they have to go through? So you mentioned ladies who have to get maybe mastectomies or the hair loss or just any physical side effect of treatment. And then that's a whole other side of, okay, so I'm going through cancer and now I'm getting treatment, but then there's actually a side effect to treatment that now I have to deal with as well.
Right, it's just awful, yeah. Yeah, and again, and I hate to be so predictable, but it's like it depends who is sitting in front of you and what their views are and what their beliefs are. And a lot of people are truly devastated at the thought of losing their hair. Or obviously, I mean, who wouldn't, if they were going through a surgery and they lost their breasts and maybe before the time of reconstruction, finding it so difficult to look at themselves. It's like, what is this? This is not me. This is not my body. I didn't ask for this. So much going on. So other people say, no, this is like a war wound. And I don't care, my hair will grow back. So it really depends on the person. But so we focus on, what's important to them. We focus and redirect into things like values. Even if I don't have hair, what could I do about that? What's important to me? Oh, well, my physical presence is important. Maybe I'll have a wig or I'll have a scarf or, I'll check out what other people have done, kind of thing. But again, empowering people with information about their options. You don't have to be kind of stuck in this emotion. And you can never sort of criticize or shame someone for what they're going through, because someone is so, some people are so strong and that doesn't matter at all. Other people are like, like I said, like sort of the younger ones. This is, when you're dealing with people in their 20s who have to have something as radical as, like a bilateral mastectomy or, it really, really is devastating for them. Whereas an older woman might say, it's okay. It's not so bad. So really depends on the person, but always about empowering, helping them to get control and giving them information on what their options are.
Do you find that sometimes the patients are just struggling to communicate their needs? Maybe they don't know what they need or they don't know how to ask for it?
Yeah, totally. And people who are maybe shy or they're less assertive and they're not used to sort of asking about what's going on, or there's often the kind of doctor-patient relationship. So people will come and go, oh, they're very, very busy. I can't ask them. I don't think they've got time, and they're very hesitant. But in those cases, I say, no, you have an appointment booked. You have paid for this appointment. You take your time and you do your breathing, and maybe you write down a list of the questions that you have. You bring in a list with you. Maybe we even sort of teach people about assertiveness, because it's so important to teach people to speak up. Like, if there's one time in your life you need to speak up, it's now. And you let people know what is going on for you. And because so many people start off going, whoa, like it's like a deer in the headlights, of course. And they're being told information left, right, and centre, and it's all a big fuzzy, confused shock. And so we try to bring in clarity and that calm, and teaching people about assertiveness, teaching people about even saying no in their households, their relationships, this kind of thing. No, I can't be available, I can't do this. It's got to become all about them. And I think the more people slowly get empowered, they get a little bit more confident, they get a little bit more self-esteem. And sometimes people will even say, wow, this journey, like as difficult as it is, has taught me what's important and how badly I've been living my life. I've been so passive, and I've been so nice, and I've been a people pleaser, and so all of these things come out of the woodwork. So, but definitely there are people who find it difficult, and that's completely okay. But again, when I get to know people and I'm checking them, I make sure, have you had your questions answered? Do you feel like people are hearing you? And how are you? This is something we hardly even ask our friends. We're all kind of running by each other and getting through our lives. It's not
that's true.
a real no, but really.
Today is sometimes forgotten.
So, and same thing, you go through the medical system, people say they feel like a number. So
does it go beyond the doctor? I mean, maybe you don't, like, the patient doesn't even know what to ask their friends or their partner. Like we discussed that the support group or like the close circle should sort of ask them, what do you need? But then what if the patient sort of has communication issues, is not able to communicate what they need? So then we're just like, okay, so I asked, but then they didn't tell me what to do, and then it's just a big gray area.
Most people, even if they tell you they're fine, you can tell by their mood. Their mood's a great indicator of how they are. And I will directly say to people, you're just not yourself today, or you seem a bit down, or what's going on? What's your mind telling you right now? And that's always a good way for people to kind of detach from whatever fears or blocks they've got. I'm just like, just tell me, what's your mind saying right now? And then it seems to come easier, because they're looking at themselves almost like an observer, and they can recognize that this is actually, this is the process. I mean, even now sitting here talking to you, my mind's saying one thing, it's saying another thing. Like, I've got no control over it. So we just start kind of tuning in, and I get people to describe what's going on in your body. Forget your mind, forget your thoughts. How do you feel? You might say, oh, I'm tense here, and I've got a headache, and I feel like I want to cry, I've got a lump. Great information for talking to them and just being able to dig a little bit and get sort of deeper than that. So this is sort of how we start. And you do it a lot with kids too, because kids don't have big emotion words. You just start very simple, and even if you start talking about other things too, what's going on for you? What's your treatment? What have you been told? What do you understand about all of that? So some kind of dialogue, and as I say, checking in with the body too.
So just sort of finding a thread to pull at. So you're just trying to find like an entry point.
And then people will even say to you, I mean, if they're confused, no problem.
Yeah, I think it's fair to feel confused in that situation. I mean,
Yeah.
it's a lot. Any advice you would like to share with us today for anyone going through that treatment, or anyone who knows someone going through treatment? And then if you would just give them one piece of advice, what would it be?
Gosh, one piece of advice.
Or two.
Probably seek support. Talk to someone that you can, even as psychologists, sometimes some people they like us and they hate us, but when they like us, it's because they know it's confidential. So we're not going to go back to anybody in the family or your friendship circle and tell them what's going on for you. So all of those fears, that shame, that embarrassment, humiliation, stress, people fear being depressed, people worry about being anxious, we can talk about that all and lay it all out and start chipping away at it, and then we can leave it and sort of go back and come back for the next session kind of thing. But it's safe, and we work on that, and everything's normalized. It's not like, oh, you're feeling depressed. There's no judgment. It's like, wow, this is so normal. Let's help you. Let's give you some strategies. So I'd say seek support, and of course the extension of that, if you are a group person, if you want to speak to someone who's actually been through it, you can reach out to various support groups in the community and get matched up with someone who might actually be able to give you different kinds of functional and helpful support.
Thank you so much, Dr. Melanie, for, this is a very complex topic. I don't think we'd ever be able to cover it in just one episode, but you did give us some insights and some advices on what we can do if just to advise someone who's going through that. So how we can deal with them, how we can help them.
Yeah.
So thank you so much.
No problem. It's lovely to be here. Thank you.
Our next episode is about a very underrated topic, men's health. We're going to give you the instruction manual. Gentlemen, this one is exclusive for you. So don't forget to tune in. We're available on YouTube, Spotify, and Apple Podcast. Until next time, stay well and keep thriving.